ADHD. Attention Deficit Hyperactivity Disorder treatment in children. Also, ADHD refers to a chronic behavioral disorder that initially manifests in childhood and is characterized by hyperactivity, impulsivity, and inattention. Not all of those affected by ADHD manifest all three behavioral categories. These symptoms can lead to difficulty in academic, emotional, and social functioning. The diagnosis is established by satisfying specific criteria and may be associated with other neurological, significant behavioral, or developmental or learning disabilities. Attention Deficit Hyperactivity Disorder, ADHD, will soon be the most frequently diagnosed chronic condition among children, surpassing asthma. AD is a condition that becomes apparent in some children in the preschool and early school years. We ignore these children by saying, "These are naughty." But recent research shows this is hyperkinetics disorder, characterized by inattention, hyperactivity, and impulsive attitude, not appropriate for a person's age. ADHD is diagnosed approximately 3 times more frequent in boys than in girls. In school-aged individuals, the lack of focus may result in poor school performance. It is estimated that between 3 and 5% of children have meet criteria for diagnosis, or approximately 2 million children in the United States. This means that in a classroom of 25 to 30 children, it is likely that at least one will have ADHD. The condition was first described by Dr. Heinrich Hoffmann in 1845, a physician who wrote books on medicine and psychiatry. Dr. Hoffmann was also a poet who became interested in writing for children when he couldn't find suitable materials to read to his 3-year-old son. The result was a book of poems, complete with illustrations, about children and their characteristics. The Story of Fidgety Philip was an accurate description of a little boy who had attention deficit hyperactivity disorder. Yet it was not until 1902 that Sir George F. Still published a series of lectures to the Royal College of Physicians in England, in which he described a group of impulsive children with significant behavioral problems caused by a genetic dysfunction, and not by poor child-rearing children, who today would be easily recognized as having ADHD. Since then, several thousand scientific papers on the disorder have been published, providing information on its nature, course, causes, impairments, and treatments. Along with homeopathic management, following care should also be taken: limit distractions in the child's environment, provide one-on-one instruction with teacher, make sure the child gets enough sleep, make sure the child gets a healthy, varied diet with plenty of fiber and basic nutrients. All of the symptoms of inattention, hyperactivity, and impulsivity must have persisted for at least 6 months, to a degree that is maladaptive and inconsistent with the developmental level of the child. Inattention. The child often fails to give close attention to details or makes careless mistakes in schoolwork, work, or other activities. The child often has difficulty sustaining attention in tasks or play activities. The child often does not seem to listen when spoken to directly. The child often does not follow through on instructions and fails to finish schoolwork, chores, or duties in the workplace, not due to oppositional behavior or failure to understand instructions. The child often has difficulty organizing tasks and activities. The child often avoids, dislikes, or is reluctant to engage in tasks that require sustained mental effort, such as schoolwork or homework. The child often loses things necessary for tasks or activities, such as toys, school assignments, pencils, books, or tools. The child is often easily distracted by extraneous stimuli. The child is often forgetful in daily activities. Hyperactivity. The child often fidgets with his or her hands or feet, or squirms in his or her seat. The child often leaves his or her seat in the classroom, or in other situations in which remaining seated is expected. The child often runs about or climbs excessively in situations in which it is inappropriate. The child often has difficulty playing or engaging in leisure activities quietly. The child often talks excessively. Impulsivity. The child often blurts out answers before questions have been completed. The child often has difficulty in awaiting his or her turn. The child often interrupts or intrudes on others. For example, butts into conversations or games. Role of homeopathy. Homeopathy helps a lot in ADHD children. If treated with homeopathy constitutionally way of treatment, after taking a thorough case history, then this can be cured permanently. In our Dr. Makar Homeopathy Online Treatment Center, many ADHD children have benefited using our advanced homeopathic treatment packages. We apply the most scientific and research-based homeopathy treatment package for this ailment that gives a long-standing cure from this condition. Major cause of ADHD. Genetics. Genetics are a factor in about 75% of all ADHD cases. Toxins and others. Alcohol and tobacco using during pregnancy and environmental exposure to lead are the cause of developing ADHD. Complications during pregnancy and birth, including premature birth, might also play a role. Diet. Habit of taking various junk foods colored with artificial food colors. The preservatives helps to store the food for long periods. Are also some major cause of ADHD. Social. Children who have suffered from violence and emotional abuse, family disturbances of parents, lack of proper care and affection can develop ADHD. Pathophysiology of ADHD. The outer surface of the brain, called cerebral cortex, is divided into 4 lobes: the temporal, occipital, parietal, and frontal lobe. The frontal lobe is involved mainly with the functions of problem solving, attention, reasoning, planning. ADHD children usually have deficits in these functions. In ADHD, there is delay in development of certain brain structures, especially the frontal cortex and temporal lobe, which are believed to be responsible for the ability to control and focus thinking. It is also found of low level of neurotransmitter dopamine that could be the cause of development of ADHD.